Those who support the repeal of the faith healing exemption believe that criminally prosecuting parents will eliminate a large number of unnecessary death and suffering of children. The first and most obvious question to ask is there an outbreak of children suffering and dying because their parents chose to avoid medical treatment? Let's start by taking a look at the death statistics to reach an accurate assessment of this perceived problem. The Idaho Child Fatality Review Team identified children who died from a lack of medical attention over the course of 3 years. They found that a total of 10 possible deaths fit this criteria. 3 children in 2011, 2 children in 2012, and 5 newborns under the age of 1 month old in 2013. So we're talking about a documented average 3 deaths per year between 2011 and 2013 attributed to the lack of medical intervention. Now, these are the only years we have research statistics for. Until recently, there was no fatality review board. All other data presented is pure speculation. Let's put this into further perspective. In total, there was 82 newborn deaths in 2013. If, according to the Pediatric Fatality Review Board, 5 of those newborns died due to a lack of medical treatment, that means that 77 received medical treatment and still died. Of those advocating to repeal the faith healing exemption, which would effectively criminalize parents for denying conventional medical treatment, argue children will die if they don't receive medical treatment. Statistics, however, reveal many more children die annually, even when they do receive medical treatment. Receiving medical treatment at a doctor's office or a hospital does not ensure health or healing. It doesn't guarantee longevity or lack of suffering. A May 2016 study conducted by Johns Hopkins researchers points to medical error as the 3rd leading cause of death in the U.S. Looking at the malpractice figures in Idaho, we see hundreds of doctors and nurses have erred in providing care to patients, resulting in license suspensions and revocation. In other research, it was revealed that nationally 14 out of every 80 children suffer as a result of medical error by pediatric hospital staff. That's 67%. Unfortunately, Idaho has no program in place for the public to review adverse events and medical errors. And without tracking these vital statistics, Idaho doctors and hospitals are able to shield their fatal lapses in care, diagnostic mistakes, and dosage errors from public scrutiny. And some of these errors, they're fatal. Take, for example, August Elliott. He had a heart condition which caused an elevated heart rate. The ailment is rarely life-threatening and was being controlled with medication. His parents had faith to bring him to St. Luke's in Twin Falls. They believed in hospitals and doctors and nurses. They trusted appropriate care would be given to their son. 7-month-old August was administered a fatal dose of the wrong medicine by his nurse. His death was ruled potassium overdose, which is not coded as a medical error. And yet, it was. He received an adult's dose of potassium. It was recently announced that August's nurse will not be prosecuted criminally, as his intent was not to harm or kill this precious baby. So sadly, here we are discussing the need for criminal prosecution for parents whose children are suffering and dying from natural illnesses, even when there is no intention to harm or injure their children. Millions of other parents hold faith in modern medicine, and yet they are not punished when the treatment fails and their children are subsequently killed or injured. Those advocating for the repeal of the faith healing exemption also argue children suffer when they don't receive medical treatment. Well, modern medical treatment is certainly not without painful effects, known to greatly diminish the quality of life. Should parents be jailed because they subject their children to months, even years, of widely accepted modern medical cancer treatments known as chemotherapy? Of course not. As a society, we would never consider punishing a parent for choosing medical treatment known to inflict intense suffering. So why would we consider punishing a parent whose child is suffering the effects of a disease? This returns us to the original questions. How many children are dying from a lack of standard medical intervention? On average, 3 a year. Is childhood suffering only related to the medically untreated illness or disease? No. Suffering is a part of the natural human existence. It is found with or without medical intervention. Why isn't there consideration here to prosecute nurses and doctors whose unintended mistreatment causes suffering and death? Well, because it's easier to hide medical errors that are not reported by hospital staff and not tracked by the health department. So now we are left with this unanswered question. Is this really about stopping the suffering of children, or is it more about forcing the conformity of their parents?